Hello, everyone. My name is Garrett, and I am the President-Elect of the NASW Washington chapter. I've also spent some time on the Legislative Action Committee, and I was also the chair of the Legislative Action Committee for a while. So I've been involved with the committee for some time and monitoring and being an advocate at the state level for the different types of legislation that NASW Washington monitors, tracks, and then advocates for with the legislature and with the governor's office. I wanted to come to you today to talk to you a little bit about some of the professional practice bills that went through the legislative session this year that NASW was an advocate for. There were several different bills related to social work professional practice that I wanted to talk about today. And the first one being a substitute House Bill 1007, which had some limits previously. Previously, there existed some limits on distance supervision for social workers. And during the time of COVID, it made it really difficult for social workers to get that supervision in person, especially being a bit unsafe. At points. So what SHB 1007 did is it removed the limits on distance supervision with some combined advocacy efforts by NASW and other stakeholders. We were able to move that bill through the legislature and get it signed by the governor. Another professional practice bill that NASW was an advocate for was HB, which is House Bill 1063, which it allows for social work trainees to have an additional renewal of their trainee license during declared emergencies. And that bill was also signed by the governor pretty quickly and took effect already April 16th. Furthermore, continuing down that line, another bill that we had advocated for was, engrossed substitute House Bill 1196. This one makes permanent rules to allow for full billing or comparable billing for audio-only telemedicine. As you all know, when the pandemic hit, it was really challenging and unsafe to see a lot of clients in person. So a lot of service providers had to switch to audio telemedicine to try and meet clients where they were at. Not everyone had the opportunity to do video. So this was an important bill that was brought to the legislature that requires the insurance commissioner to have a study and to make further recommendations beyond just currently allowing for full billing for audio only telemedicine, but to develop further policies related to telemedicine. And it also extends the telemedicine collaborative that currently exists to inform the legislature and the governor on telemedicine type issues. So NASW was a firm advocate for that. It also passed the legislature and was signed. So engrossed second substitute House Bill 1477 is a bill that will be probably talked about in a different in a different video as well. But this one sets up 988 as the behavioral health emergency call system. So another bill that that social workers advocated for is engrossed second substitute bill, or engrossed substitute Senate Bill 5229 that requires health equity training for social workers and other health professions. Social work is not immune to issues related to equity, diversity, and inclusion, and it's important for us to have a competency in the area of health equity and how that affects people's ability to access and how they engage in healthcare. So this would require each covered profession to have to complete the training once every license renewal cycle. And so that will now apply to social workers as well. And this is something that we advocated for as something that would be positive for the profession. Let's see, we also advocated for another bill that was called Substitute House Bill 1348. And this is something that, this is a bill that was pushed through the legislature that we were very supportive of, that would assure that people who are being discharged or leaving jails and prisons would be immediately reconnected with their Medicaid coverage. This bill actually passed unanimously in both houses. And it's something that the state could have done a long time ago, but this is a very simple fix because a lot of the people that receive services from social workers fall through the cracks when they go into jail or prison and they lose their Medicaid. This is something that would hopefully keep them on their Medicaid insurance when they were discharged from jail. And that would automatically be reinstated. Something that we also worked on this year is that because of the workforce challenges that we face, there was a bill that was proposed to the legislature called Engrossed Second Substitute House Bill 1504. And that is putting more funding towards the scholarships and loan repayment programs to hopefully bring more social workers in, as well as to keep social workers here. That also passed with overwhelming support. There's currently a program that exists where social workers can apply to get their loan assistance for their student loans if they commit to staying and working within the state for a while. This was passed to boost that program. So hopefully we are able to, attract and retain more social workers in the future. ESSB, which is Engrossed Substitute Senate Bill 5399, that creates a healthcare commission, and that to study the option of creating universal healthcare. This would take a look at how we can develop a plan and implement by 2026 to provide comprehensive and affordable health coverage to every single person in Washington state, particularly those who are under publicly financed. This would include publicly financed and privately financed healthcare systems in the state, and hopefully cover all state residents, no matter who you are. This is something that's been going on, and it's been a movement in Washington state for a long time, but it's had a lot of challenges given that Washington has had a hard time figuring out how to pay for it, particularly since there's no income tax allowed. So this is going to create a commission to study how to make something like that happen. Kind of a dovetail from the social work profession, but kind of runs alongside it. Another bill that went through the legislature was Engrossed House Bill 1311 that allows the Department of Labor to set up an apprenticeship program for substance use disorder professionals. This NASW lobbied to have this bill amended to make sure that the Department of Health was approving all the educational elements that went a part of the apprenticeship program. This isn't something that NASW got super involved with, just because it has to do more so with substance use disorder professionals, but it would also have to do with social workers who are interested in becoming substance use disorder professionals and might actually look at going down the apprenticeship pathway, or working with substance use disorder professionals who are going on the apprenticeship pathway as well. Couple other sort of like dovetail professional issues that were passed in the legislature this year. Substitute Senate Bill 5068 will keep low-income women on Medicaid postpartum for a full year compared to the current 90 days that cut off. A lot of times complications from people that go through pregnancy. My wife is pregnant right now and may experience some of this at some point. Let's hope not. But a lot of times women can experience complications with their pregnancy after the 90-day cutoff. So this would give more support to women who are recovering from having a pregnancy and also help deliver health insurance to them and their families. There was also a Senate Bill 5151 that realigns foster care and childcare licensing that went through the legislature this year. It also expands outdoor nature-based childcare and suspends licensing fees for the next 2 years and makes other improvements to childcare and early learning. NASW was supportive of this. Substitute House Bill 1221 will also align state definitions of homeless with those in the federal McKinney-Vento Act. Basically is redefining it as someone who lacks a fixed, regular, and adequate nighttime residence. So the bill was also sponsored by Representative Alicia Rule of Blaine, Washington, and she's also an NASW member. And it also kind of removes some of the confusion over the intersection of state and federal law and creates a clarification for Washington state. So I know that was a lot of information, but this is some of the professional issues that went through the legislature this year. This year was very favorable to social workers. And so I'm hoping that you'll tune in to some of the other videos that Some of our other members will go over. Some of those other issues are related to social justice, NASW's push for reimagining public safety, economic support for those who are under-resourced, the state's response to State versus Blake, which is the Supreme Court decision in Washington State that recently came down related to substance use possession or substance possession. And then there will be more on budget and other types of overview things that hopefully you'll see posted by NASW as well. Thanks for listening.